During the first semester or this semester, um, I had a more personalized and somewhat simplified view of mental disorders, not realizing the magnitude of how many disorders there were. I really focused on schizophrenia, bipolar, depression, suicidal idealizations, things that I witnessed coming into the hospital here in Jackson, Michigan. I have learned quite a bit through this abnormal psychology class, and I'm very grateful to have taken it. I primarily one of my one of my primarily my biggest reason for taking this class was learning how to deal with different types of mental health disorders through not only my employment, uh, also at home with my wife, who also suffers from treatment-resistant depression, bipolar 2, and malabsorption as well. She had the onset of her disorders or mental illnesses at the age of 28. She's now 41. She's undergone ECTs, which is electroconvulsive therapy treatments, transcranial magnetic stimulation, which is TMS. Um, both of these have had little effects on her overall health and well-being. They do provide somewhat of a short-term fix. The ECTs lasted a year. However, her memory was affected so badly, she had to be reminded who her husband was, where she was at, what her name was. Sometimes after treatments, after waking up, she would have night terrors, light sensitivity. Um, the other problem I'd like to address with healthcare and the mental health is going forward. The insurance companies um, will make you jump to the hoops, all these loopholes and hurdles. They approved my wife's ECTs for a second round instead of doing the less invasive EMS, the cranial magnetic stimulation. So I had to pay for all the TMS out of pocket, which was quite expensive. I think that needs to be changed. Back to what I've learned in this class, um, I really had a simplified version of what I was going to internalize as far as dealing with people coming into the hospital and just witnessing their behaviors. I didn't realize it was not only genetic, but there's other factors, involved. Um, I'm very grateful for this class, and I think that in the future it will help me be able to assess um, and learn different strategies on how to deal with the incoming patients at Henry Ford Health Systems, and also it has broadened my view on how to deal with my wife's bipolar 2 and her malabsorption, as well as her depression. The malabsorption is a little bit different than most conditions. Her body only will absorb about 50% of everything she ingests. So once again, going back to the medical care providers, a lot of the books and a lot of the tests and research fail to expose that or talk about that. Um, Healthcare providers are very reluctant to give someone a full dose right off the bat or right off the rip. Um, they want you to ease into the medication. Where with my wife, she can't ease into the medication because it'd be ill effective. Another problem with the malabsorption is when you're dealing with the mood stabilizers, the antidepressants, antipsychotics, the um, the duration is a lot shorter. So if you're on three different ones, like she's on one of each or two of each sometimes, if if I notice a change in behavioral patterns, we do not know which one is not being absorbed. So that presents another hurdle. in her care and being able to effectively manage this medical illness. When you change a script or a vitamin, even sometimes it takes 2 to 3 weeks to take effect. So now we're in a transition mode for 2 or 3 weeks, wondering if this is the right one. It may be, and it might not be. So it's kind of a cat mouse game on that. Other than that, I think the abnormal psychology classes help me be able to recognize the all treatments aren't the same. It's not everything needs to be individualized and personalized. I know the book talks a lot about cognitive therapy and cognitive behavioral therapy, and um, I understand that. But there's also other treatment programs that I wasn't aware of, like I am now. And just to sum it up, I'm glad I took this abnormal psychology class, and I'm glad that Dr. Mudge pushed. I'm sure she pushed everybody, but she personally pushed me, uh, making me dig a little deeper and being able to look at all the different circumstances and available treatment options on a lot of these mental illnesses. So, thank you for your time.